the 152nd press briefing of Shanghai regarding COVID-19 control. We're going to brief you about the latest measures that we have taken and also answer your questions. We have with us Madam Wu Qianyu, Level 1 Counsel of the Municipal Health Commission. Mr. Fu Chen and Peng Wenhao from the Municipal Commission of Market Regulations. May I first give the floor to Madam Wu Qianyu. Dear friends from the media, good morning. On April the 12th, we have added 1,189 new confirmed cases and 25,141 asymptomatic cases in Shanghai. 867 of the newly confirmed cases were found in the closed-off area. We advise our citizens to bring with you your identification card, your mobile phone when you are conducting the nucleic acid test, and also do a good job of self-protection, cooperate with the temperature taking, maintain a social distancing of 2 meters, avoid conversations with each other, and after the NAT, put on the mask and return home. According to the weather forecast, the temperature may drop today and there might be a gust of wind. We'd advise the residents to put on more clothes and also pay attention to traffic safety. And here I would like to take this opportunity to pay tribute to community cadres, volunteers, and health workers. I also want to thank the cooperation from the general public. Thank you very much to Madam Wu Qianyu. Now we are open for questions. Please identify yourself before asking the question. Line number 25, please. Thank you very much. I'm with China Daily. My question is directed to the Municipal Health Commission. You mentioned that we have to strengthen the standardization in terms of release from the makeshift hospitals, but there are complaints of the lengthy processes, and what plans do you have to optimize this process? Thank you very much for your question, and this is a question of wide concern. We follow the same standard in terms of releasing patients from the makeshift hospitals, and Shanghai is following the 9th edition of the National Protocol on COVID-19 treatment. We are strictly following these standards. Specifically, when a confirmed case or patient enters the makeshift hospital, we have to conduct the NAT on a regular basis, starting from this second day. But there should be an interval of 24 hours. When the negative result is obtained for several consecutive days, then the patient can be released from the makeshift hospital. We also follow the same standard in terms of admitting people into the makeshift hospitals. The makeshift hospitals are mainly for those with mild cases and also asymptomatic cases. We put in place medical observations for all the people, and there are people with chronic diseases and some pre-existing conditions. In previous press briefings, we have given you much information in this regard. We are leveraging traditional Chinese medicine, and our practice has shown that TCM has proven very effective. But the effectiveness is different on different people due to the different immune system of the people, and there are pre-existing conditions among the population, and that may generate an impact as well. According to our statistics, the average time that patients stay in makeshift hospitals is 1 week, but some people may just need to stay in the hospital for a shorter period of time, but in average, it's 1 week. In terms of releasing people from the makeshift hospital, we have to speed up because the patients, they have to make preparations, and we have to do a lot of work in terms of transporting the patients to where they live. We need to better coordinate the efforts from many different links. I think you have seen that over the past few days, there is an increasing number of people being admitted to makeshift hospitals, and some large makeshift hospitals, they are registering an increasing number of patients being released from the hospital each and every day. So these hospitals, they have to be prepared, both in terms of releasing patients out and also coordinating vehicles and resources from different sites, and they have to transport the discharged patients back to their homes. As we accelerate our pace of coordination, I believe our patients can expect much smoother processes. Next question, please. Line number 3. Thank you very much. I'm with Xinhua News Agency. We have noted that there is a letter of risk warning issued by the Municipal Market Regulation Bureau, and what are the countermeasures that you have to solve the lack of vegetables and food? Thank you very much for your question. Over the past few days, community-based necessity purchase has become the main approach for people to meet their need, and this has played a very important role. And we are playing a supportive role in this regard in order to straighten the price of daily necessities. Recently, the Shanghai Municipal Market Regulation Commission has issued a letter of risk warning. We are simply reminding market entities and businesses to provide necessities and commodities at a proper price. The price has to be clearly indicated, and also the quantity, quality, and information of the product should be clearly indicated, and they have to provide very good service to our customers and also safeguard the interests of our customers. And taking today's opportunity, I would like to remind our customers to select products that's a quality guaranteed, and they have to pay attention to the following three areas. Number one, whether it carries the mark of community purchases, whether it carries information of the products, and whether there is precaution about potential quality issues, and whether the contact information of the provider is indicated. We also ask the citizens in this city to keep record of the relevant information so that they can get in contact with the after-sales persons once there is any quality issue. Where there is a adjustment of the product packages or delayed delivery of the necessities, we advise the different market entities to push the information immediately to customers, and going forward, the Market Regulation Authority of the city will continue strengthening on regulation over price activities, and we will crack down on those who sell goods in the name of community purchases, and we will bring those to justice. If the residents have identified some potential violations, they can dial the complaints hotline of 12316. When the violation activity is identified, they will be properly handled according to law. Next question, please. Line number 10. Thank you very much. I'm with Liberation Daily. Let me quickly follow up. How should we disinfect the necessities delivered to their doorsteps? Thank you very much for your question. Upon receiving the commodities or necessities purchased via community group buying, they have to conduct a disinfection, and they should refrain from having direct conversation with the delivery service. And when they are claiming the goods and necessities at the community entrance, they have to wear a mask. We advise a disinfection using various sterilizers. If the goods are contained in a paper box, make sure that the paper box is properly disposed, and they better be thrown in a dustbin outside the community. When you bring the necessities or goods back to your home, put it in your balcony where there is direct sunshine, and this can also help with the disinfection. If it's vegetables or fruits, we strongly advise not to use chemical disinfectants because it may affect the hygiene of the food or the taste of the vegetable, and you can wash those vegetables with flowing water or sink it in water, dry it before you cook it. And also, after all those processes, wash your hands with flowing water. Wash your hands with the soap. In this process, you should not touch your nose or mouth with your hands. We hope that those precautions can be strictly observed. Next question, please, line 20. Thank you very much. I'm with Shanghai Daily. My question is that there is wide complaints among the residents that the vegetables they are having a much higher price, and what countermeasures do we have in this regard? Thank you very much for your question. And recently, the Shanghai Municipal Market Regulation Authority has strengthened its regulatory activities against price hikes and speculations. As of April 11th, the authority has dispatched more than 30,000 staff cracking down on price speculations, and we have issued more than 30,000 pieces of price warnings. And we are pressing relevant market entities to rectify their speculation behaviors, and for those who engage in price speculations, they are properly handled, and we have publicized also quite a number of typical cases. For example, 2 supermarkets have increased their delivery price, and they also speculated on the price, and the relevant holders of those businesses, they have been held accountable, and going forward, the authority will continue focusing on key areas related to people's livelihood and also to necessities related to COVID-19 control. We are going to strengthen our regulatory behaviors on key areas, and we hope that all the e-commerce platforms can shoulder up their responsibilities. They need to intensify their oversight on the behaviors of the merchants registered on their platforms. In the meantime, we are going to coordinate with the district-level authorities to step up supervision on price activities so that we can identify potential violations on an early basis. In the meantime, we are going to tap into various resources to identify different clues. We can collect more evidence from the online channels. For example, there are people complaining about the price of vegetables and food. There are some typical cases, and market regulation staff have been dispatched to those cases, and most of those cases were properly handled within the first 24 hours. We call on all the market entities to strictly follow the law to stabilize the prices, and wherever price speculation activities are identified, they will be properly handled, and relevant business owners will be held accountable. And I would also like to update the public about one new development. Recently, the Municipal Development and Reform Commission and the Market Regulation Authority are conducting joint efforts to straighten price speculations in the delivery link. In the meantime, we are improving the price complaints channels, different market entities, and platforms. They are placed under more strict control and supervision. And not long ago, a supermarket openly said that its commodities were originally planned to be sold to Hong Kong, and that is a misleading information publicly disseminated down to the markets, and we also held that business owner accountable. And going forward, we will continue safeguarding the legitimate rights and interests of the customers. Last question, please. Line number 15. Thank you very much. I'm from Oriental News. As some of the communities are lifting their control measures and there will be a larger flow of people on the streets, mainly those daily support staff, and what measures do we have for those population? Thank you for your question. I believe that you are referring to this guarantee staff playing an important supportive role in delivery in COVID-19 control, and we have to look at the risks they are exposed to, and they are recommended with the proper COVID-19 control medical equipment and tools. And for those who do not directly expose themselves to COVID-19 risks, for example, traffic control staff, and also those maintenance staff working outdoors, or drivers who do not deal directly with the closed-off areas and controlled areas, and they are basically supported with medical masks and also gloves. And those volunteers and guarantee staff working within the closed-off area or controlled area, they have to wear a protective suit apart from the masks and gloves, and they also need to wear a protective hat and special shoes. Those outdoor working staff, should they enter the closed-off area or controlled areas, I'm talking about, for example, those NAT staff or community volunteers, and those who work directly on a post of community control, they are at the front line of COVID-19 control, and they have to wear N95 or K95 or above masks. They have to wear protective goggles apart from the other medical equipment that I mentioned above. For those who have to enter the homes of closed-off areas or controlled areas or other indoor spaces, for example, if you have to knock the door of those confirmed cases, or if you have to knock the door to take people's temperatures, or take the samples of nucleic acid of the people, or handle the garbages at the community level, this falls into the category of level 2 protection. And they have to wear medical protective suits. And after using those personal protection equipment, they have to put off the PPE at a designated place and then put that in a designated dustbin. And those PPEs have to be properly handled. They have to disinfect. their clothing, and this is the full process of doing personal protection for those key posts. All right, this is all to today's briefing, and we will keep the public posted if there is any updates. Should you have any questions, you can get in contact with the Municipal Health Commission. Thank you.